You know, when most people hear the term heart failure, they instantly think of a total, sudden stop, like an engine just seizing up and dying on the highway. But as we dive into this explainer today, you're going to see that the reality inside your body is a whole lot more dynamic than that. It's actually way more like a massive, complex plumbing system that's desperately trying to manage a catastrophic backup. We're going to trace those pipes, look at the central pump, and really understand the incredible and frankly sometimes totally flawed ways our bodies try to cope when the main engine starts to struggle.
So, what's actually happening when your heart quote-unquote fails? Well, like we said, it's not a hard stop, it's a profound plumbing issue. The symptoms we typically see don't just magically appear out of nowhere. They're a direct result of mechanical breakdowns and the body's frantic attempts to compensate. The heart just can't pump enough blood to meet the metabolic demands of your tissues, and as you'll see, that one primary failure sets off a massive, full-body traffic jam. Here's our roadmap for today. We're going to look at when the pump fails, compare acute versus chronic onset, break down systolic and diastolic dysfunction, check out the kidney's flawed rescue attempt, and then wrap up with a full-body portrait to see what this all looks like on the outside. Let's get right into it.
All right, Section 1. When the pump fails. This is the central plumbing issue at the very core of it all. The absolutely crucial thing to grasp here is what we mean by decreased cardiac output. Imagine a giant bustling city, right? And the main traffic interchange suddenly just completely bottlenecks. Because the heart is failing as an effective pump, your circulation literally backs up. It gets totally congested. The blood just isn't moving forward fast enough to feed your cells. And this simple mechanical drop in output, that's the primary domino that knocks over every single symptom we're going to talk about today.
Moving right along to Section 2, acute versus chronic onset. Because this pump failure doesn't always happen exactly the same way.
It really comes down to two distinct timelines. First, you've got acute onset. This is sudden, boom, like right after a myocardial infarction, a heart attack, where the heart's contracting ability is instantly, directly damaged. The pump gets abruptly compromised. But then, on the flip side, we have chronic onset. This is a slow, gradual wearing down. Think of hypertension. The ventricles are forced to pump against this chronically increased pressure day after day after day. Over time, that relentless resistance just wears the pump out. But honestly, whether it's a sudden strike or a slow grind, the end result is exactly the same: decreased cardiac output.
Let's jump into the actual mechanics of the dysfunction in Section 3. Systolic versus diastolic dysfunction, a tale of two pumping problems.
Okay, before we compare those two types of dysfunction, we kind of need a baseline metric. A normal, healthy ejection fraction sits right there between 50 and 70%. Now, what is that? It's simply the percentage of blood the heart pushes out with each beat, compared to how much blood was sitting in the chamber right before it squeezed. Just keep that 50 to 70% range in the back of your mind, because it's an absolute game changer for understanding how this whole system breaks down.
So the mechanics can essentially fail in two different ways. On the left side here, we have systolic dysfunction, or HFrEF. This is where the heart just can't contract properly. The squeeze is super weak, and because of that, the ejection fraction drops way below that healthy 50% mark. But look at the right side, diastolic dysfunction. This is absolutely fascinating. The heart muscle wall has gotten super stiff, so it can't relax fully between beats. Because it won't relax, it doesn't fill up with enough blood. You still get a dangerously low cardiac output, but get this, you actually have a normal ejection fraction at rest. We call this HFpEF. The major catch here is that while the fraction looks fine while you're resting on the couch, that stiff heart cannot ramp up output when faced with the stress of exercise or high blood pressure.
All right, brace yourselves, because Section 4 is probably the most ironically tragic part of this whole explainer: the kidney's flawed rescue.
You know, it's wild how the body's own survival instincts can actually make things so much worse. Look at step 1. The heart isn't pumping enough blood. The kidneys sense this drop in flow, and they panic. They think, oh no, we're losing blood. We need to save the body. So, moving to step 2, the kidneys try to compensate by hoarding sodium and water, trying to build up blood pressure. But check out step 3. The heart is already failing as a pump. Adding all this extra water and sodium just massively increases blood volume and venous return. The kidneys are literally pouring more fluid into a traffic jam. It creates this massive vicious cycle that just skyrockets the congestion throughout the entire circulatory system.
So where does all that backed up fluid actually go? Let's trace the pipes in Section 5, a full-body portrait.
Starting right at the top, a weak pump means less oxygen makes it to the brain. Neurologically, this triggers serious anxiety, gasping, falling oxygen saturation.
and in really severe cases, confusion or even unconsciousness. Meanwhile, because fluid is backing up from the left side of the heart, it completely floods the lungs. This causes dyspnea, shortness of breath, and specifically orthopnea, which means you can't breathe when you lie down flat. If you were to listen to those lungs, you'd hear crackles, wheezes, and a patient might even develop a cough with this very distinct frothy pink or white sputum. The lungs are literally drowning in the backup.
And man, the congestion definitely doesn't stop at the lungs. In the cardiovascular system, you'll literally see the jugular veins in the neck bulging out. You're looking at decreased blood pressure, a super weak pulse, a rapid heartbeat as it desperately tries to compensate, and this extra heart sound called an S3 gallop. If you look at the skin and eyes, the sympathetic nervous system is in full fight or flight mode. Pupils dilate, the skin, which is being starved of proper blood flow, turns this pale gray or cyanotic color and feels cold and clammy. The body is shunting resources just to keep the lights on.
Finally, as we move down the body, gravity and severe venous congestion really take their toll. The spleen and liver swell up, fluid pools heavily in the abdomen, that's called the ascites, and you get dependent pitting edema, which is major swelling in the sacrum and legs. Because blood flow to the gut is totally compromised, the entire gastrointestinal tract just kind of slows down. Fluids and bile back up, causing severe nausea. And remember those kidneys we talked about? Since they're so busy desperately hoarding sodium and water to fix the output drop, your actual urine output absolutely plummets. The whole body is just waterlogged and starved of flow at the exact same time.
So wrapping up this fascinating plumbing tour, the biggest takeaway here is that treating heart failure is the ultimate balancing act. On one hand, you absolutely have to support that struggling central pump, whether it's dealing with acute damage, chronic pressure, systolic weakness, or diastolic stiffness. But on the exact same hand, you have to carefully drain and manage all that excess fluid backup caused by the kidney's misguided rescue attempts. It is all deeply, deeply connected.
Which really leaves us with this final, incredibly provocative question. If our own kidneys are inadvertently sabotaging the system by hoarding fluid during a crisis, how can modern medicine outsmart our own biology to relieve the congestion and actually help the body heal? It really makes you rethink the body's internal logic, doesn't it?